So we'll get a good spectrum. So if this is the vessel, then we are at 90 degree, right? If vessel is this, then at 90 degree, will we get any flow? We won't get. Then this is near 60, the second one. Again, we'll get lot of error. So this is a better, and this angle is definitely less than 60. So that's how to place the cursor line to get a good flow. You have to manipulate that, so that's important. So here you see angle to flow. What is this? This is the vessel wall. What is the angle? 90. So you see very bad flow. Go to and fro. So you get aneurysm. It's not aneurysm. It's a normal vessel. It's quite smooth walls. Absolutely normal vessel. You will make aneurysm on spectral. So this is now a proper line. This angle is, and you will get a nice crisp image here. And here again you see very nice. So cursor angle correction only used to measure velocity. Cursor is, some people that little bit sample volume cursor is in different machine at different shapes. They try to rotate it that it might be playing with the angle, do something with it. It's not has nothing to do with angle. This line is important, and that another line which makes an angle with the vessel. So this cursor, this is just a sample volume. To get the sample volume, it is not making any angle. For angle, there is another line. You have to rotate the machine. We'll show you in practical session how to get that line. Spectral Doppler, sample volume, we have already discussed that. That sample volume should be 1/3 of the vessel. Size ranges from 1.5 to 30 mm. This, if it's covering the whole of the vessel lumen, we'll get a thick spectrum, might lose good information. If it's normal, 1/3, we get a very good spectrum. And if there's a sample wall is big, you see, it's a very thick spectrum. It's not the true picture of the vessel central velocities. And if we open the gate wide, then we might get both the venous and the arterial flow. If sometime we want to have a qualitative analysis, that we want to know the presence or absence of flow, then it's fine, open your gate wide, you'll get all the velocities going there at venous, arterial, and then you bring your that sample volume to the area of interest. Here we are seeing both arterial and venous, both types, because our that sample volume gate is wide open. So what is recommended? The sample volume size should be no larger than 1/3 of the size of the vessel. If larger, the sample volume is capturing slower flow that occurs near the vessel wall, which is not required. Gain, we discussed that as in ultrasound there are gains. In the same manner, there are Doppler gains. If you increase the Doppler gains very high, you see, you can't see this window, you can't see this nice spectrum, and this is very high gain. You do so many things in that, and you can't diagnose. You have to bring the gains down at a proper manner. If your gains are too low, the spectrum will be eaten up. You will lose the spectrum. So it should be, the PRF, we were discussing that aliasing, if there is aliasing, the vessel is very narrow. The velocity, rocketing of velocity is 500, 600, then you have to adjust your PRF. The rate at which the transducer is pulsed per second. If that rate is high, we can measure very high velocities. If that rate is low, that we can measure only low velocities. If we are placing our probe with low PRF on an arterial segment, we get headless peaks. We won't be able to see the upper end of the velocity. So we have to set it. If we are going to scan for veins, I will set my PRF at minimum. If I am going to scan a stenosis, I have seen a mosaic pattern, I have seen that color growing, I will set my PRF at the highest point to get the highest velocity. So velocity scale have to be set. If it's not set, you see, you will get headless peaks. This is a spectrum, you don't see the peak. The head is cut off. So you can't measure this. You will be losing, if you measure up to this, you are only measuring about 50% of the velocity. So you can't do anything if you don't know how to set the PLF. Wall filters. If you set your wall filters very high for a low flow, you will lose all the information. For very high flow, you keep your wall filter at a higher level. Then sweep speed. If it's the fast moving blood and fast moving spectrum, the sweep speed should be high. For Venus, it should be, when we want to see the Valsalva maneuver and we want to see the reverse and forward flow, the sweep should be sufficient enough to have all that wave patterns towards the probe, away from the probe, towards the probe and back during the Valsalva, that we do that to see the reflux. And again, that sweep speed is, if it's very slow, we'll have only one part segment of the spectrum. The rest of the spectrum won't be there. So it should be fast enough to capture all the three spectrums over there. Then angle, pulse Doppler signals. How can get good angle to flow? Wall filter, Doppler gain, scale low unless aliasing, adjust gate size and frequency selection. You can decrease that if you don't get proper PRF.